Hi, my name is Jody, and today I'll be doing the newborn assessment, talking about infant feeding and bathing, and then infant safety for when your patient is discharged from the hospital. So first I'll be talking about the newborn assessment. So here's my newborn. Her name is Ellie. The first thing you want to do with the newborn is prevent hypoxia. So make sure they're in a position for good drainage. You want to use the syringe bulb to get any fluids in their mouth and in their nose. The next thing you want to do is you want to prevent cold stress. So it's important to dry the baby really well, and while you're drying them, it's kind of rough, which also helps the fluid get out of the lungs, and then they'll hear that loud cry. You want to either wrap them or place them in the warmer to help regulate their body temperature. And if they can and the mom wants to, this is when you can do some skin to skin if they score high enough on the ABGAR. And the next thing you would do is the ABGAR test. So with the ABGAR, you'll do it 1 minute after birth and then repeat it again at 5. And the ABGAR, you're scoring based on 5 things. So heart rate, you can use a stethoscope or by palpating the cord. For respirations, do they need assistance? Is it weak? If they have a loud cry, is it strong? And then color, are they blue? Or are they pink? Or are they pink in the middle with blue extremities? Reflexes, like how do they react to stimuli? So when you touch the baby, are they retracting their feet? Are they actively moving? That would be, I guess, more towards the last one, which is tone of extremities. Are they flaccid? Are they moving? Are they flexed? Next, after the ABGAR, you want to make sure you assess the umbilical cord. Is it bleeding? And also in the umbilical cord, it's important to note the amount of arteries and veins. So there should be 3 vessels, 2 arteries, 1 vein. After that, it's important to place ID bands on both baby and mom and partner if they decide. All their numbers were matched, and it's for security purposes. And there'll also be a security band placed on baby, so the baby can't be taken outside of the mother's ward area. This is when you can leave the baby for a little bit with the mom, but it's important to come back within the hour to offer the eye prophylaxis, which basically you want to make sure the eye is clean, and you drop in the middle of the eye and you leave it. You want to educate the mom not to wipe it off, even though it looks gooey and gross, to leave it. This helps with prevention of gonorrhea. And then the other 2 options they have is a vitamin K shot. This helps with the baby's blood to clot, and the Hep B vaccine. The Hep B one is the only one I think you need written consent for, but you do want to explain what you're doing before you do anything to the baby. After this, you document, you report anything that's abnormal, and that would be the end of your newborn assessment. The next thing we're going to talk about is feeding. So 2 options, breast and bottle. So for breast, you want to make sure the mom's hands are clean, your hands are clean, and their breasts are clean. When you clean the breast, you just want to use water, warm water. You don't need to use soap. It's first important to hand express by pressing down on the boob and leaving the express milk on the nipple. It's important for the mom to get in a position where she is comfortable first before placing the baby on her. It's important for the baby to be positioned on the mom where breast tissue won't be blocking the baby's nose. That can prevent the baby being able to breathe. There's 4 different positions to holding the baby while you breastfeed. The football pose, which is under here like this. There's across, cradle, and if the mom's sideline, the baby can lie next to her and nurse that way. It's important though when you're watching the baby begin to breastfeed as a mom and the nurse that you assess if they are latching and sucking appropriately and have like a good quality. So if you hear clicking, it's not great. You want to see the cheeks moving and swallowing. For after they're done, so when the baby is still latched, instead of just yanking the baby off, it's important that you use your finger to go inside the corner of the baby's mouth and release the latch, so it's easier for the baby to come off. After that, you burp. Some breastfed babies don't burp if they have a good latch because there's no air coming in. And then 30 to 45 minutes after feeding, you want to keep the baby upright to prevent aspiration. So bottle feeding is a little bit different. You need a doctor's order to know exactly what the baby will be eating. You want to make sure the infant's head is above the stomach when you're holding them. When you have the bottle, you want the nipple of the bottle to be full of milk and the nipple to be on top of the baby's tongue. Same thing when it comes to latching. You want to make sure it's a good latch. And breastfeeding, they recommend every half an ounce or an ounce you burp the baby at least halfway through and at the end, or whenever necessary. And the same thing with after this feeding. Keep the baby excuse me, in an upright position for 30 to 45 minutes to prevent aspiration. Okay, the next thing we're going to talk about is bath. You can either do a submerged bath or just like a wipe down with the cloth bath. You're allowed to do either now, even with the umbilical cord. It's important that when you're doing a submerged bath, the water remains warm. 100.4 is the recommended temperature. Clean eyes first from the inside out, using a clean piece on your washcloth each time you clean the eyes out. It's important when it comes to babies' neck creases and rolls that when washing and drying, you make sure you take special care and get it all clean and then all dry. You want to make sure you assess the cord again. So you're making sure there's no bleeding. Is there an odor? Is there any drainage? Is there normal atrophy? Which means we want the umbilical cord obviously to fall off and die. So seeing that it's doing that properly is important. Cleaning the genitalia obviously is important during bath time. And then right after bath, you want to make sure you dress the infant so they can stay warm and regulate their body temperature a little bit better. Okay, the last thing. Infant safety, patient teaching at discharge. So the three most important would probably be for sleep, ABC, on your back, alone, and in a crib. This helps prevent SIDS. For car seat, rear facing until about 2, and you don't want them swaddled or in big jackets, just them in the buckle. And then the last one, don't shake your baby. If you're frustrated, tired, set the baby down, give them to someone else. Don't shake the baby. You can hurt them even the slightest bit of shaking. And that was my newborn assessment, infant feeding and bathing, and infant safety. Thank you.